Hey YouTube, today we are going to discuss how we can leverage artificial intelligence in the field of medical diagnostics. So who am I? My name is Shahzaib and I develop multiple type of AI based infrastructures for my clients at my own company. So let's get into it. The first thing that I would like to discuss is CAD. So what is CAD? CAD is basically a term that is going on from a long time in the field of medicine. It is called computer aided diagnostics. So wherever we are taking help from a computer, that is called we are leveraging new technology for medicine. Aided diagnostics has been in the talks for a long time, and now with the new advancements in the field of artificial intelligence, we are actually seeing a lot of things that are happening with the help of this technology. As an example, we are seeing people doing gait analysis with the help of computer vision. We are seeing people detect cancer cells with the help of computer vision. We are seeing people, do research on things such as MRI scans or chest X-rays, right? And people try to, detect COVID with the help of chest X-rays. So things like that. One particular firm that I would like to discuss about that is ChestX, that has actually worked on a lot of problems that are related to computer vision. There are other firms as well that have worked a lot, and the main diseases that I would like to discuss today are Alzheimer's disease or disease related to cancer. And after that, if I get time, I would discuss a little bit about how we can bring the fracture based studies into all of this as well. So first, let's discuss the first one. But before that, I would like to discuss about one very important issue, which is healthcare and data. So basically, data is something that is very much critical when we are talking about medical diagnostics. The data should be 100% reliable. So for example, if you have data from some place where you think the person was not good enough, or the camera was not good enough, or the sensors were not good enough, they were cheap or anything like that. So whatever model you develop with the help of that data will not be able to help you later on, because if there is anything wrong with that data, then you cannot get or accomplish good results. So this is something that I have actually seen before when I was developing a gait analysis based algorithm, and until that time I got good enough data, there was no reason to actually test multiple type of gait analysis algorithms there. So data is the first thing that we should have, and it should be of the perfect attributes. Other than data, the next thing that I would like to discuss is how this field is actually, for example, if we talk about statistics a little bit, in the year 2022 there has been a push of something like $14 billion into the industry of AI healthcare, and it is being said that until 2029 it will be up to $164 billion, right? So medicine people are really taking their money out for the sake of artificial intelligence. So if you are either related to artificial intelligence or you are related to medical field, you should consider learning about this or even implementing it to test it out. Now there are a few case studies that I would like to discuss, and the first one is of Dr. Aaron Nicholson, who is a AI researcher at AEHRC, and he totally emphasizes on teaming with healthcare professionals for data extraction to development and testing and development of different type of architectures. Now, one of the things that they have developed is ChestX. I talked about this before a little bit as well. But before diving more into it, I would like to talk a little bit about what he said about data. So he said that together we can identify a problem that needs solving. Maybe you want to diagnose COVID-19, as I have told you before as well, from chest X-rays. But then for something like that, you need data. And this data can be available publicly, or it can be, coming from a clinical partner. So there we go. These are the two methodologies from where you can get your data. Either it is publicly available by some government, or it is available to you from any clinical partner that you have that is working on something similar. Now, for any one of you who is a little bit clear with the terms that are related to medicine, MRI scans are basically better for visualization of soft tissues, right? And CT scans are better at, making sure that the results are more geometrically accurate, right? So what ChestX did was they combined both of these, and they detected the prostate cancer by sort of combining both of these methodologies. The first methodology was MRI based and the second methodology was CT scan based, and they combined both of those methodologies using computer vision, of course, to get an algorithm that gives very good and accurate prediction for prostate cancer. Later they have also talked about, Dr. Aaron, of course, that they want to come to a different type of cancer treatments or other medical related diagnosis that can be done from things such as MRIs or CT scans or something familiar. But right now I am discussing something that is already there. So now let's discuss a little bit more about CAD systems in which AI is already integrated. So basically the CAD systems are very much in use nowadays, right? And from one study it is also shown that the false positive marks per image, right, by using AI in a CAD system reduces the false positive marks per image by a whopping 69%. So I would of course attach that study below in the description as well. And what this means is it is a huge advancement. And if with the advancement coming in with the help of generative AI, if we can implement transformers and bring all of those things into the mix and develop a new way for computer vision as well, then I think we could go one level beyond this as well. So this is the first thing that I wanted to talk about when I'm saying about CAD systems. There are a few other statistics that I'm going to share now. And one statistics specifically says that the identification of microcalcifications and masses that are of course present in the patient bodies reduce the false positives by 83 and 56%. So the first study said 69% and the second study said 83% and 56%. So all of these things are huge and good enough results to actually start doing incorporation of artificial intelligence in medicine today. Even when we are talking about someone like radiologists, they have a lot of advantages with this. And what does this do? This mitigates the socioeconomic issues such as emotional stress as well as the financial burden on the radiologist, right? So for example, if there is a radiologist who has to read something for 1 hour, then the person will have to read the same thing for 17% less, whatever that might be, meaning almost 50 minutes, 50 point something, something like that, right? So it will decrease the reading time by 10 minutes for each report. So that matters a lot. Even when we are talking about something like fractures, if there are clinicians that are not very much experienced, there is a chance of misdiagnosing in fractures. And fractures is not that deep rooted application that it has to be like this, right? So it is something that AI can come into play very much easily with the help of X-rays, right? Because we have a lot of data available with the help of X-rays that helps us actually to diagnose fractures better. In one case study, what they are doing is they are taking original radiographs, right? And after processing them, they are creating their conditional heat maps with the help of deep neural networks. And after doing those heat maps, they are taking out the output images, and the output image I will also show that on the screen, shows up better result than the original image. So considering that, there is a lot of work that has already been done in the field of fractures as well. So one study that I would like to discuss about about X-rays is being done with the help of Royal Australian and New Zealand College of Radiologists. So they had two different types of data sets. One data set was more than 5,000 X-rays from patients with femoral neck fractures or some similar fractures, right, from 2009 to 2019. And that second data set was again more than 500 pelvic X-rays, right? So those pelvic X-rays were divided into two parts for each image, right? So what they did was, there is a pelvic X-ray and they divided into two parts, one where there was no fracture, one there if there was fracture site present, right? So these were the two data sets, and what they concluded from these 10,000 images is that the accuracy actually was up to 96% using, of course, AI-CAD. The sensitivity was 95%, specificity was nearly around 97%, and area under the curve was almost 99%. And they used grad CAM for this one. In the same way, of course, radiologists are also using the same methodology for breast or chest cancers, you can say, right? And there are a lot of publicly available data sets that are available, and pretty much very significant results in the 90s, right? 95-96% have been achieved for these kind of diagnoses, right? So of course this one is not something very much new. It has been happening for a few years. But now what is happening in this as well, they are also bringing in segmentations and feature extractions and things like that. And right now we also have transformers into the mix as well. So the researchers are trying to include transformers into the mix, right? I have also done something similar in which I developed gait analysis based on human pose estimation, right? And that gait analysis actually also was for children with restrictive movement. We did the gait analysis to see which of those children actually needs surgery, and we compared it with the data that actually told us that in reality did they have surgery or not. And by comparison of both of them, we got to a result that our results are actually very much good. Of course, the same study is also attached in the description, and I followed that study and implemented my own algorithms there. So again, there is a lot of room in the field of medical diagnostics when we are talking about artificial intelligence. And we are also working on a few new projects as well, right? So of course, next time we are also going to see more applications of artificial intelligence. Pretty much I work with generative AI nowadays, but I talk about artificial intelligence as a whole because there are a few projects that are in the field of artificial intelligence, and there are a few projects that are in the field of generative AI. So I'll keep talking about my experiences and what I feel about artificial intelligence. And if you think what I am saying makes sense, just talk to me and we'll see where this goes. Thank you very much. Talk to you soon. Bye bye.